Hello, and thank you for joining this video presentation. Today we will discuss the use of Veklury, remdesivir 100 milligrams for injection across the COVID-19 disease spectrum, leveraging insights from clinical practice. My name is Neera Ahuja, and I'm a practicing hospitalist with extensive experience treating patients hospitalized with COVID-19, using remdesivir as the standard of care. Additionally, I was a primary investigator for the ACT 1 clinical trial that studied remdesivir in hospitalized COVID 19 patients. Before we begin, let's review the indication and some important safety information for Veklury. Veklury is indicated for the treatment of COVID-19 in adults and pediatric patients younger than 18 years of age, weighing at least 1.5 kilograms, who are hospitalized or not hospitalized, have mild to moderate COVID-19, and are at high risk for progression to severe COVID-19, including hospitalization or death. Veklury is contraindicated in patients with a history of clinically significant hypersensitivity reactions to Veklury or any of its components. COVID-19 remains a significant health issue in the United States, having led to over 6 million hospitalizations and 1 million deaths since 2020. And despite the availability of an updated 2023-2024 COVID-19 vaccine, uptake of the booster amongst children and adults remains low. Fortunately, multiple treatments are available to help treat COVID-19 across a wide range of disease severities, including the product we'll discuss today, Veklury. During this video, we'll review studies that evaluated the impact of Veklury on disease progression, time to recovery, mortality, and readmission. To start, we'll review two pivotal trials, Pine Tree and ACT 1. Then we'll discuss the World Health Organization's Solidarity Trial. And finally, we'll finish by describing outcomes from a real-world readmission study. Now, we'll review the Veklury pivotal clinical trials Pine Tree and ACT 1. Veklury was evaluated in hospitalized patients with COVID-19 in the National Institute of Allergy and Infectious Diseases ACT 1 trial and in high-risk non-hospitalized patients with COVID-19 in the Pine Tree trial. Results from these studies supported the FDA approval of Veklury for use in both inpatients and in outpatients at high risk for disease progression, respectively. First, let's review ACT 1. ACT 1 was a randomized, double-blind, placebo-controlled clinical trial of 1,062 hospitalized adult patients with mild, moderate, or severe COVID-19. Mild and moderate disease were defined as oxygen saturation greater than 94% and respiratory rate less than 24 breaths per minute without supplemental oxygen, while severe disease was defined as oxygen saturation less than or equal to 94%, en room air, a respiratory rate greater than or equal to 24 breaths per minute, an oxygen requirement, or a requirement for mechanical ventilation. Patients were randomized 1-to-1 to receive Veklury or placebo for up to 10 days. The primary endpoint was time to recovery within 29 days after randomization, and recovery was defined as being well enough for discharge or hospitalized but not requiring ongoing medical care or supplemental oxygen. As you can see in the image here, the overall population had a mean age of 59 years, 64% were male, 53% were white, 24% were Hispanic or Latinx, and the most common pre-specified conditions were hypertension, obesity, and type 2 diabetes mellitus. In the primary endpoint, Veklury helped shorten time to recovery for patients hospitalized with COVID-19 by 5 days compared with placebo. Getting patients out of the hospital sooner is an important outcome for many healthcare providers, with one hospital pharmacist stating that the 5-day shorter recovery time is a clinically meaningful endpoint. ACT 1 also evaluated the incidence of new oxygen use as a secondary endpoint. Compared with placebo, patients treated with Veklury were less likely to progress to mechanical ventilation or ECMO, or to non-invasive ventilation or high-flow oxygen if they had not received either at baseline. Incidence of new non-invasive ventilation or high-flow oxygen was 29% lower in the Veklury group than in the placebo group, while incidence of new mechanical ventilation or ECMO was 43% lower in the Veklury group than in the placebo group. One critical care pulmonologist emphasized the importance of reducing the need for new oxygen support, stating that a reduced risk of mechanical ventilation and ECMO translates to fewer patients in the ICU. In addition to endpoints we've just discussed, overall mortality at day 29 was evaluated as a separate, pre-specified endpoint. The reduction in mortality for the overall population at day 29 was not statistically significant, although Act 1 was not powered to evaluate the difference in mortality in the overall population. In a separate post hoc subgroup analysis, Veklury was associated with a 70% mortality reduction at day 29 in patients on low flow oxygen at baseline, which accounted for the largest patient population enrolled. The other groups did not demonstrate a reduction in mortality. Moving on to safety. In Act 1, the frequency of adverse reactions was similar between Veklury and placebo. Laboratory abnormalities were also comparable between groups, demonstrating that Veklury is generally well tolerated in hospitalized patients with COVID-19. Now, let's review Pine Tree. This was a randomized, double-blinded, placebo-controlled trial that evaluated 562 high-risk, non-hospitalized patients with mild to moderate COVID-19 who were symptomatic for 7 days or less. It is important to note that patients were not included in the trial if they were receiving or were expected to receive supplemental oxygen or hospital care at the time of screening. Patients were randomized 1-to-1 to receive either Veklury or placebo for 3 days, and treatments were first administered to patients in outpatient facilities, home healthcare settings, or skilled nursing facilities. The primary efficacy endpoint was a composite of COVID-19 related hospitalization or death from any cause by day 28. In Pine Tree, patients at high risk for disease progression were defined as those with at least one risk factor for progression to hospitalization, including hypertension, cardiovascular or cerebrovascular disease, diabetes mellitus, obesity, immunocompromised state, chronic mild or moderate kidney disease, chronic liver disease, chronic lung disease, current cancer, sickle cell disease, or being 60 years of age and older. By evaluating this population of high-risk, non-hospitalized patients, Pine Tree expanded the potential use of Veklury to a new setting, with one emergency medicine physician noting, "It's helpful for me to know that whether I admit a patient or send them to one of our outpatient clinics, Veklury is available and can be a treatment option in either setting." Beyond having one of the risk factors listed, the study population had an average age of 50 years. 52% were male, 80% were white, 42% were Hispanic or Latinx, and most often presented with diabetes mellitus, obesity, and/or hypertension as pre-specified coexisting conditions. The primary efficacy endpoint showed that non-hospitalized patients with COVID-19 at high risk for disease progression who received a 3-day course of Veklury had an 87% lower risk of COVID-19 related hospitalization or death from any cause by day 28 compared with those who received placebo. This outcome was driven by hospitalization since no deaths occurred in either arm of the study by day 28. The incidence of adverse events for Veklury was similar to that in the placebo group. Serious adverse events occurred in 1.8% of patients in the Veklury group, compared with 6.7% in the placebo group, and discontinuations due to adverse events occurred in 2 patients taking Veklury, compared with 5 patients taking placebo. Overall, the results of this trial demonstrated that Veklury is appropriate for use in a variety of outpatient settings. Let's review some important safety information. Hypersensitivity, including infusion-related and anaphylactic reactions, has been observed during and following administration of Veklury. Most reactions occurred within 1 hour. Monitor patients during infusion and observe for at least 1 hour after infusion is complete for signs and symptoms of hypersensitivity as clinically appropriate. Symptoms may include hypotension, hypertension, tachycardia, bradycardia, hypoxia, fever, dyspnea, wheezing, angioedema, rash, nausea, diaphoresis, and shivering. Slower infusion rates with a maximum infusion time of up to 120 minutes can potentially prevent these reactions. If a severe infusion related hypersensitivity reaction occurs, immediately discontinue Veklury and initiate appropriate treatment. Transaminase elevations have been observed in healthy volunteers and in patients with COVID 19 who received Veklury. These elevations have also been reported as a clinical feature of COVID 19. Perform hepatic laboratory testing in all patients. Consider discontinuing Veklury if ALT levels increase to greater than 10 times the upper limit of normal. Discontinue Veklury if ALT elevation is accompanied by signs or symptoms of liver inflammation. Co-administration of Veklury with chloroquine phosphate or hydroxychloroquine sulfate is not recommended based on data from cell culture experiments demonstrating potential antagonism, which may lead to a decrease in the antiviral activity of Veklury. The most common adverse reaction, at least 5% all grades, was nausea. The most common lab abnormalities, at least 5% all grades, were increases in ALT and AST. Now, we'll present the World Health Organization sponsored trial Solidarity, as well as some real world data for Veklury. Okay, let's discuss the Solidarity trial. Solidarity was an open label, multi center randomized trial conducted in 35 countries in adult patients hospitalized with COVID 19. Patients received local standard of care and were randomized 1-to-1 to receive remdesivir or its control. The primary endpoint was in hospital mortality, overall and subdivided by disease severity as defined by ventilation and supplemental oxygen use at entry. Results from the trial showed a 13% relative risk reduction in mortality in a combined group of patients on low and high flow oxygen at baseline compared with the control. In the overall population and all other oxygen status subgroups, there was not a statistically significant reduction in mortality. Before we continue, let's review some important safety information. Administration should take place under conditions where management of severe hypersensitivity reactions, such as anaphylaxis, is possible. For patients who are hospitalized, Veklury should be initiated as soon as possible after the diagnosis of symptomatic COVID 19. For patients who are hospitalized and do not require invasive mechanical ventilation and/or ECMO, the recommended treatment duration is 5 days. If a patient does not demonstrate clinical improvement, treatment may be extended up to 5 additional days for a total treatment duration of up to 10 days. For patients who are hospitalized and require invasive mechanical ventilation and/or ECMO, the recommended total treatment duration is 10 days. For patients who are not hospitalized, diagnosed with mild to moderate COVID 19, and are at high risk for progression to severe COVID 19, including hospitalization or death, the recommended total treatment duration is 3 days. Veklury should be initiated as soon as possible after diagnosis of symptomatic COVID 19 and within 7 days of symptom onset for outpatient use. Perform hepatic laboratory and prothrombin time testing prior to initiating Veklury and during use as clinically appropriate. No dosage adjustment of Veklury is recommended in patients with any degree of renal impairment, including patients on dialysis. Veklury may be administered without regard to the timing of dialysis. Available clinical trial data for Veklury in pregnant women have not identified a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes following second and third trimester exposure. There are insufficient data to evaluate the risk of Veklury exposure during the first trimester. Maternal and fetal risks are associated with untreated COVID 19 in pregnancy. Veklury can pass into breast milk. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Veklury and any potential adverse effects on the breastfed child from Veklury or from an underlying maternal condition. Breastfeeding individuals with COVID 19 should follow practices according to clinical guidelines to avoid exposing the infant to COVID 19. Outside of clinical trials, Veklury has also been evaluated in a real world setting. Readmissions data were analyzed in a large retrospective cohort study in U.S. patients using the PINC AI healthcare database. Adults with COVID-19 treated with Veklury were compared with those not treated with Veklury across variant periods from May 2020 to April 2022. The primary endpoints of this study were 30-day all-cause readmission and 30-day COVID-19 related readmission to the same hospital after being discharged alive from the index COVID-19 hospitalization. These data were analyzed using an adjusted multivariate logistic regression model, which adjusted for age, corticosteroid use, variant period, Charlson Comorbidity Index, maximum supplemental oxygen requirements, and ICU admission during the index COVID-19 hospitalization. Ultimately, the study population included approximately 441,000 patients from 852 hospitals, with a total of roughly 249,000 Veklury patients, compared with roughly 192,000 non-Veklury patients. The study included patients who were at least 18 years of age, were discharged from the index COVID-19 hospitalization from May 2020 through April 2022, and had a primary discharge diagnosis of COVID-19 flagged as present on admission. Patients who were pregnant, had incomplete data, were transferred to or from another hospital, were admitted for elective procedures, or had a discharge documented as expired or hospice were excluded from the study. This study included a broad range of patient types, although some patient characteristics were varied, with those in the Veklury group being slightly younger and more likely to have received some level of supplemental oxygen support compared with those not treated with Veklury. Those in the readmitted group tended to be older, had more comorbidities, were more likely to require no supplemental oxygen, and were less likely to be treated with Veklury compared with the non-readmitted group. This study had some limitations, such as not accounting for potential readmission to a different hospital from where the index COVID-19 hospitalization occurred, not matching patients, and not accounting for the number of Veklury doses administered. Additionally, while real-world studies are an important supplement to randomized controlled trials, their data should be interpreted based on the type and size of the data set and the methodologies used, and should be considered carefully in the context of all available data. The results of the real-world study demonstrated that hospitalized adults treated with Veklury were 40% less likely to be readmitted for a COVID-19 related cause to the same hospital within 30 days, compared with patients who did not receive Veklury. Significant reduction in hospital readmission associated with Veklury was consistent across all variant periods and all supplemental oxygen levels. Additionally, hospitalized adults treated with Veklury were 27% less likely to be readmitted for any cause to the same hospital within 30 days compared with patients who did not receive Veklury. Significant reduction in hospital readmission associated with Veklury was consistent across all variant periods and all supplemental oxygen levels, except for invasive mechanical ventilation, or ECMO, which did not meet statistical significance due to a low sample size. These outcomes were observed despite the Veklury group having a higher supplemental oxygen requirement during their index COVID-19 hospitalization as compared with the non-Veklury group. This brings us to the end. But before we wrap up, let's summarize the main points of what was covered. Despite the availability of vaccines, patients continue to become infected with COVID-19 and progress to requiring hospitalization and treatment. Veklury is the first and only FDA-approved treatment for use in both adult and pediatric patients who are either hospitalized or not hospitalized with COVID-19. In clinical trials, Veklury helped shorten recovery time, reduce disease progression, and had a comparable safety profile to placebo. Collectively, the clinical data for Veklury supports its use as a standard of care for appropriate hospitalized patients across the COVID-19 disease spectrum. With that, I'll bring this video to a close. For more information on this topic and important safety information, please visit vekluryhcp.com. Thank you for your attention.